Okay, everybody. I believe it's 12 o'clock now. We're going to go ahead and get started. I am Helen Hockey, Executive Director of Pennsylvania Coalition for Oral Health, and I want to thank you all for joining us on this Friday afternoon on such a beautiful day. Hopefully you're having a beautiful day. I know in southwestern PA it's quite gorgeous right now. We offer these brief updates a few times a year to, share some of the work that PCOH has been doing. As always, the meetings will be recorded and we will share it on our YouTube channel, so you can share the link with others after today or revisit anything that you might have missed. And you can also view our older recordings there as well. Some housekeeping as we get started. We are in a webinar format, so all lines have been muted by us, so we will have no background noise. You can type any questions at any time into the Q&A box, which should be at the bottom of your screen. And I may be able to jump on and answer some of them as they come in, but we will definitely have some time at the end for questions as well. We will also send the link out for the presentation directly to everyone who is registered for today's event, as well as the slides by themselves as a PDF, so that you can click on any of the active links and check out any resources that we mention. So I do want to start by introducing our dedicated team here at PCOH. Each of our team members does an amazing job juggling about 1 million different things every day. And one of the things that I'm most excited to share today is that we have recently grown our staff to 6 with the addition of Natalie Walker this year. And I know she's going to be a great help to all of our work. So super excited to be able to share the growth of our staff right now. And as we move forward, we really are just excited to collaborate with all of you. I see a lot of familiar names in our attendee list, as well as some new names, which has me really excited. And we're so grateful to all of our partners and stakeholders who are working to create a healthier oral health future for Pennsylvania. So I want to say a special thank you to our PCOH Board of Directors, who each provide their time and their leadership to our work. We are really proud as a nonprofit. We're very proud of the investment that our board members make in PCOH. And I do want to ask our board chair, Micah Gursky, to say a few words of welcome this afternoon. We'll turn it over to you, Micah.
Thank you, Helen, and welcome everybody to our mid-year webinar update. I want to thank you for spending some time with us. But also thank you for being a stakeholder with the Pennsylvania Coalition for Oral Health. If you are like me, you've relied on Helen and the team and her network of stakeholders to help you with your work. And you've also been on maybe a helper for somebody else that's in the coalition that needs your expertise. So we do appreciate your support and being part of this. I also want to note that we're celebrating our 10th anniversary as an organization. And so that's a milestone that we want to mark. It seems like we've been around for a lot longer, but 10 years is a significant milestone. We're also doing a 10th anniversary fundraising event. So if you're interested in supporting the work of PCOH and Helen and her staff, please consider a donation this year. And I want to thank Helen. I want to thank the staff and the board members for all the daily work that you do across Pennsylvania, but also representing Pennsylvania across our nation too. So we really appreciate it, and looking forward to the update. Thank you, Helen.
Absolutely. And just to note that Micah has started his term as board chair in January and has really done an amazing job so far. So really excited to have his passion and expertise leading the board. So thank you very much, Micah. Very much appreciated. So we're going to go through a little bit of information about the coalition, share some of the work that we've been doing, ask for your help probably in a few spaces. And so wanted to start with just touching on some of our top priorities. Our priorities really drive our mission to enhance oral health in Pennsylvania. So we've got a few key focus areas, really looking at the development of the oral health workforce. We do that through education, data analysis, training, connections, all of the above. We also do a lot of advocacy work in the community water fluoridation space. We know that fluoridated water benefits all people, especially those that have limited access to dental care. Our third priority, is really looking at improving oral health for vulnerable populations. So groups, rural populations, people with disabilities, low-income families. There are just 1,000 reasons that we need to improve our equitable access to dental care in the state. And so that becomes a focus of our work quite frequently. And then lastly, really looking at how we can advance oral health policy and infrastructure. So state policy, community policies, anywhere we can get oral health inserted, we are hoping to do that. And we do that through a ton of collaboration and advocacy work. So those are the main priorities that really guide our commitment to oral health in PA. And we really just sort of remain grounded in those to support our mission day after day. We are a registered 501c3 nonprofit, and we, generally have been able to report for the last 5 or 6 years now that, more than 80%, sometimes 85% of our funds that are raised go directly to our programs. So some of our programs we supply ourselves, some we work with partners and subcontractors on. And many of our programs do use federal dollars and community grants, but we also rely pretty heavily on our corporate and organizational and individual funders to keep us moving, because that's really that's the good funds that help fill in the work that isn't always necessarily covered by a grant deliverable. So many of our funders have been, providing this annual support for many, many, many years, more than 10 actually at this point, and we really couldn't do it without them. So you see some of the big names on the slides, all of our bigger corporate and foundation sponsors, but we also have a ton of individuals who contribute annually during our appeals. So, we gladly publish that list in our impact report every year. And definitely please encourage everyone to visit our website so that you can click directly on our funders' websites and learn more about them as well. So our supporters really become sort of the backbone of all the work that we do. And, every contribution that we receive in that space really does help us achieve our goals. So when we talk about the work we're doing today, it's because of the support of all of you. And so thanks to all of your support for over the years. We're really, really excited, as Micah mentioned, that we are going to celebrate 10 years of PCOH this summer. So it's been 10 years this coming August since we were first incorporated. And we want to, do a number of things this year to really celebrate that. So we're going to launch some new content that's going to illustrate the progress we've made since 2016. We would love to hear from you all, what your favorite PCOH stories or moments have been. So we have a survey that we have a link to, and we'll put a link in the chat, but it will also be shared after. So hopefully you can tell us, what you remember about PCOH. If you've been around since the beginning, we want to hear that information. And we also wanted to do a special fundraising campaign. So in honor of our anniversary, it's a great time to sort of reinvest in the work that we're doing and help us support the next decade, where I think we're going to grow significantly again. And our first goal for this summer was to have 10 supporters donate. We are almost there. We actually have 9 supporters already, just since we announced it. So that's our first goal, and we'll be announcing goals all summer as we work through that. So just want to say, again, thank you for being part of our journey. As a personal note, I have been in my role with the coalition now for over 9 years, and I continue to just be humbled every day by the passion and the interest in all the work that we do from our stakeholders. It really does make a difference, and it makes coming to work every day a blessing. So thank you, and I do think we're making progress. So we're going to talk a little bit about that progress. Again, looking back on 10 years and what do those connections look like and where have we touched, it's really incredible to reflect on the breadth and the impact of our programs and our initiatives. So each one of the efforts on this slide, represents a really vital link in this whole chain of oral health improvement. We've done a lot of work in the oral health education space. That has laid sort of the groundwork for individuals and communities to improve their oral health. And then, at the other side of things, we're looking at advocacy, and we're looking at Medicaid advocacy and different policy advocacy, so that we can sort of change the infrastructure of Pennsylvania to fully support people. And I'm not going to go through all of these, but, you can see some of the commitments we've made over the years. Water fluoridation remains a key target. School-based health programs have really become something that has risen to the top as an effort that we need to put some space in. Try to reach all of the young individuals in Pennsylvania where they're at, rather than waiting for them to come to us. And some of that then requires efforts in workforce expansion, right? So we're going to talk a lot about workforce today, but that kind of goes hand in hand with the school-based health programs as well. And then we see a lot of collaborative efforts between other fields. So thinking about maternal and child health, disability care, systemic health for conditions like diabetes, nicotine cessation. All of these are places where we can intersect and kind of get oral health in there to make healthier folks. So we've done a wonderful job in sort of touching the surface of all of those things, and we continue to sort of keep those programs moving forward. Some of them sort of come and go a little bit depending on funding sources, but we're always willing to have those conversations with anyone who's working in those spaces. So next, I want to walk through some of the key focus areas that we've been working in recently, and share some of the challenges that we're facing, and how we're trying to work to change things in those environments. So always got to start with community water fluoridation. One of the main reasons that PCOH was started was to advocate for water fluoridation in all communities in PA. What was interesting is we realized that our oral health issues were a little bigger than just water fluoridation, and we've of course grown since then, but it's really our roots come from water fluoridation. So, at a time when we're really focusing on helping people and getting them the resources they need to live their very best lives, fluoridated water is really the most important population health measure that we can incorporate for good oral health. It's a practice that's been used safely for over 80 years, thousands of studies on its effectiveness, definitely one of the most heavily researched health interventions. And hopefully you all have seen, there have been a number of recent articles in the last even just 2 weeks, where folks are really standing by, some EPA information, some different rulings, where fluoridation is still being actively supported. So we want to make sure that people really understand that it's effective because it reaches everyone in a community. So regardless of income, insurance, ability to access oral health care, fluoridation is there for you. So we've had a lot of great discoveries in, fluoridated toothpaste and preventive dentistry, but those don't always reach the folks who aren't actively seeking them. So water fluoridation is really the way to reach the whole population. So that's why it becomes so important to the work that we do. So challenges that we've faced when we talk about the different issues, obviously in the space, we see kind of a time right now where dental appointments are becoming really hard to come by. We've got providers that are retiring or leaving the state in large numbers, and water fluoridation sort of is this public health measure that reduces cavities for up to 25% for everyone just by turning on the tap. Unfortunately, we've seen a lot of opposition from the federal administration, which has created some hurdles in maintaining and promoting our fluoridation efforts across the state. The headlines, right? So the headlines people are seeing, those headlines tend to be influencing decisions and votes in local communities right now. The entire CDC Division of Oral Health was sort of disbanded last year, but we're really happy to see that the division is supposed to be refunded. So we're watching that very closely, and we're hoping new staff will be hired. But it is a little tricky right now to see where that federal approach is coming from. And then lastly, we have about 175 water systems in Pennsylvania that offer optimally fluoridated water to their customers. So historically, over the time that I've been with PCOH, we've seen 3 or 4 systems each year that have it come up, the subject is raised, there's some kind of debate, should the water be fluoridated? And we're starting to see a rise in those numbers of those debates and the rollbacks, all around the state. And so I think that that's really sort of our biggest concern right now. So I wanted to share a quick map that we developed just to show the full gamut of rollbacks and threats that we've dealt with over the last 10 years. So I don't know about you, but that map to me is very telling to see all of those dots. So all of the blue markers are indicating, townships or water systems that have brought up the subject of water fluoridation, debated it. Some of them, it's just been a conversation. Some of them, it's been a full-on vote in 6 months of meetings. And we have been involved in all of them. So when I look at this map, it does make me a little bit tired. But of those systems that are listed there, 11 of them have either decided not to pursue cessation or they've publicly voted to keep water fluoridation. The rest have ceased their programs, which is a big concern because now we have hundreds of thousands of Pennsylvanians that don't have that protection in their water any longer. And so just to give you an idea of sort of what that battle looks like. So, we do manage, a statewide task force. We have, just this year alone, we've worked with 7 different systems and attended and provided testimony at 9 different borough and council meetings. So just since January, we've done quite a few presentations on fluoridated water. So to different populations, we're always willing to do that, if that's something of interest to the organizations you're involved with. We've been able to award water equipment grants to water systems who want to, purchase new equipment that they need to keep fluoridating. And so almost $25,000 this year already, which has been wonderful. And then we continue to collect a ton of data, anything that we can get on levels and how water systems are doing. We've even had issues with fluoride supply, right? So when water systems have to purchase fluoride to work with their water systems, we have to sort of help them. Okay, well, this one doesn't have any, well, let's get you somebody else. And so these are all the different ways that we do some outreach in that space to keep systems fluoridating water. So how you can help, we do manage a small task force that I'll say stands at the ready to fight these rollbacks. It doesn't require much of a commitment. Really, we're just sending out updates and emails to the folks that are on the task force. And then if a community that's local to you kind of comes under fire, we may reach out and say, hey, are you available to go and say this, information at a meeting? And we can even help write that information. Or if you work with a community group that can send a letter to help support it. It's not a big ask. So if you're interested in joining the task force, you'll have the link to be able to do that. And then the other way that we really just are sort of getting everybody out there is to encourage folks in your communities to really look beyond the headlines. One thing that I have learned this year from all of these local meetings that I've been going to is that it helps to really ask people why they have the opinions they do. When rumors are flying around about fluoride, it's really best to ask for the source and kind of push to see where that negativity is coming from. Often you can course correct and give some real research, science that helps people understand the benefits and the fact that there really are no negative drawbacks. And, sometimes you can't change their minds, but for a while we kind of just ignored them and we've decided that we really just can't do that anymore. So we're definitely being more proactive in our support of water fluoridation this year. So the next subject we're going to provide an update on is our Medicaid advocacy work. We've got about 3 million people in Pennsylvania that rely on Medicaid for healthcare in our state. So it's really important that there's adequate access to dental care and dental providers. In addition to benefits, that shortage of providers that are actually willing to accept Medicaid has left a lot of kids and adults without access. So anytime we can, we're talking about that with decision makers. I threw some pictures up of just some work we did last week in the advocacy space. So when we talk about that lack of access, we're referring to network adequacy most of the time. Our state and federal government actually require that insurance companies and health plans have to have a sufficient provider network. So you can't have an insurance that you offer to somebody, but no providers who accept it. And so with, our wait times going up and up in Pennsylvania, we've got some of our dental clinics with 2-year wait times. It sounds like we're really not meeting this requirement. And I'm going to show you a little later when we talk about workforce, some of the numbers that really affect this even more than insurance participation. But when it comes, to Medicaid, what it really boils down to is that we've got less than 1,000 dentists that are regularly seeing Medicaid patients. And so, you've got 3 million kids and adults with 1,000 dentists to see them. And so you just can't make those numbers work. It's also really not easy to ask dentists who are in very high demand right now to take 40 cents on the dollar of a reimbursement over their cash patients. So we're seeing that even in general, dentists not taking any insurance whatsoever. So the Medicaid space becomes pretty difficult. We continue to do a lot of advocacy. The restoration of the full comprehensive benefits for adults in Medicaid is a top priority for PCOH. We've been pursuing this in a variety of ways over the last 10 years, including legislative advocacy. So for those who aren't as familiar, our state runs on a 2-year legislative session. So every 2 years you can introduce bills and they have 2 years to pass. We were able to introduce last year House Bill 583, which would restore the comprehensive dental benefits for adults in Medicaid. It does remove a lot of red tape for providers and patients as well. And it did pass through the House, was sent to the Senate, but it's been sitting there since last year. So we've got about 5 months left to get it through the Senate. And if it does not pass through the Senate at that time, then we would have to reintroduce the bill in January in the next 2-year session. So that's sort of our biggest amount of work in the Medicaid space. I know I've also mentioned our ADA pilot project on previous webinars. We were part of a multi-state effort through the Department of Human Services to increase the number of Medicaid dentists in the system. So the ADA right now is putting some finishing touches on that report, and those should be out very, very soon. And we were also fortunate to join another multi-state collaborative that's currently focused on Medicaid advocacy that's being managed by the Center for Healthcare Strategies. So Pennsylvania is sort of out there working with other states, trying to learn from others. And I do want to point out our Department of Human Services has worked really hard over the last year or so, maybe 2 or 3 years, to add, things to the fee schedule and increase preventive services that are covered by Medicaid. They even cover services that some private insurances don't. So we want to make sure that dental providers are aware of this. So talking to dental providers becomes another key point. And then, of course, a shout out to Nicole on our team, who's been working really hard to meet with as many members of the PA General Assembly and the federal delegation from PA as she possibly can, to educate them on oral health and the issues we're facing. So I think, and I would hope you guys would agree, 72 meetings with legislators and staff since January is a lot. So Nicole's been all over the place trying to get that done. And then lastly, through a grant we received from the CareQuest Institute, we were able to hire a consultant late last year to complete an analysis of the issues in our Medicaid system, as it pertains to dental care. So that report was just finalized this week. We're actively sharing it this week and next week with our managed care organizations and the Office of Medical Assistance programs. And what we're really hoping to do with that is just identify some small changes that we can implement right away to kind of help fix the system and make things easier on patients and providers. So not major drastic changes, just little tiny baby changes that hopefully will help everybody. So how can you help? We definitely need the help in educating our lawmakers. Oftentimes we can go and talk to a legislator, but if we don't have someone who's a constituent of theirs or who lives and works in their communities, they don't really hear us. So if there are folks out there who would love to join us for a meeting or help us connect with a local office, we would love to have that help. And we have resources. We're happy to kind of help write talking points for you and even help schedule those meetings. I always add sign up to be a Medicaid provider on here, knowing that we do have some dental providers on the call, but also, everyone on the call is hopefully going to a dentist. And, when's the last time you asked your dentist if they're accepting Medicaid? It's not a bad idea. We can really advise providers that they're able to see just a few patients if that's all they want to do. So it becomes kind of a way to pay back in your community, to see a handful of families, help some folks out in the community on a regular basis. So not just one time a year, or not just volunteering on a mission trip, that you could actually help people in your community every day. And then making sure, as you run into challenges with credentialing and paperwork, please share, right? Let us know. We hear a lot of people complaining, but I don't know that those complaints make it to the right ears. So we want to make sure that we can sort of help guide people to the right folks to kind of address some of those complaints. And I wanted to also highlight the document to the left of the slide today. So this was part of a June 2025 operations memo that was released by the Pennsylvania Department of Human Services. And it serves as a decision tree flowchart of how Medicaid health plans can approve additional services for adults through the benefit limit exception process. So I think it's really helpful for anyone who's involved in patient care. And I've got the link to it there, so you guys will have that after. And we've seen a pretty significant increase in approved services since its release last year. So it's working, and I think that's really great. So next, I'm going to spend a little bit of time talking about workforce. Workforce, I feel like, has risen to the top everywhere. For us, the dental workforce and the public health workforce are really intertwined. So, we're trying to increase access to care for all of those who need it. Leah on our team was able to join current dental students at Penn last week and actually talk about the benefits of pursuing careers in public health. So when we talk about challenges in workforce, we talk about numbers quite a bit. We've got a number of reports that we've published over the last 5 years on this subject, but the overall recommendation is that we need more training programs and more providers across the board. We graduate more than 300 dentists annually in the state, but only about 5 to 10% of our Pennsylvania grads are choosing to practice in the more underserved areas of Pennsylvania. Many of them are just leaving the state as soon as they graduate. So we have the official number, and that's the little map on the left there, is that we actually win the award for the #1 out-migration of newer dentists leaving the state out of all 50 states. Over 13% of our younger dentists are leaving the state each year. So that's a huge problem. We need to keep them here so that they can continue to see our residents. Another challenge that we run into is that we need more Pennsylvania residents to apply to dental school. Our dental schools are actually doing a really great job in trying their best to enroll Pennsylvania residents, but they are not getting nearly as many in-state applicants as they need to. And so I wanted to share a little chart here, because all the times when we say workforce challenges, everyone says loan repayment, loan repayment. It's very important, but we also know that when a dentist is graduating with more than $300,000 in debt, getting a portion of that back in loan repayment may not always make the difference for them. So where we've sort of landed, after doing all the research, is that where dental students are coming from is probably the most important factor in how to have more new grads stay in Pennsylvania. So just to quickly go over the information in this chart, we hear all the time that dental schools should just take more Pennsylvania residents and our problems would be solved. I've even said that myself a few times, right? Before I actually looked at the numbers, I said, why don't we just get the dental schools to take more PA people? But it's not that simple. So if you look at the yellow bands, you can see the total number of applicants to our dental schools that were PA residents last year kind of was around 200 students per school, right? So that's out of 2,000 applications on average, right? So less than 10% of our dental school applicants are from Pennsylvania. And then we look at the green numbers and we see how many Pennsylvania residents were accepted and enrolled in the dental schools. And you can see those numbers are significantly higher. So I think it's pretty clear that our dental schools are trying very hard to take a higher percentage of PA residents, but we just need more applicants. You can't take 80% applicants when 8% of your applications are from Pennsylvania. So it's a major reason that PCOH is focusing on the pipeline right now and trying to build up all the way back to middle school interest in dental careers. So understanding these issues is to me very vital for getting some solutions together for dental care accessibility. So I do want to go through a couple quick maps to show how general dentist practice locations and specialty practice locations are impacting dental care access across the state. So this slide examines the distribution of our general dentists. So this is information from the 2025 licensure survey. It categorizes two separate things. So one is practice locations by county. So the numbers on the slide are the total number of dentists who list that county as their county of primary practice, okay? So for example, there are 559 dentists that say they practice in Allegheny County, seeing patients, right? And then the shading is actually measuring the density of the dentist per 100,000 people. So we want to compare to population. So the national recommendation is to have 60 dentists per 100,000. As you can see, those really dark counties on the lower right are the only ones that are even over 25. So we are definitely not hitting our numbers anywhere in density of dentists, and we're really sitting at less than half of what we need for the majority of the state. So we ran some of those numbers for some specialties as well. On this slide, we're examining the number of pediatric dentists that are available and working in Pennsylvania. So the very light blue all across the top there, no pediatric dentists that listed as their county of primary practice, none. That's a pretty big dental desert across the northern tier and central PA. So a lot of the families that live in those areas are now driving 2 to 3 hours to get to a pediatric dentist, which has become a major issue. So we also wanted to look at oral surgeons because, you know, we're doing a little better here than we are in pediatrics, but there's still some pretty large areas of the state where oral surgery is not accessible. You know, our current adult Medicaid dental benefit really encourages extraction over saving teeth through root canals and crowns, right? So this is a major barrier. We've got a lot of general dentists now that aren't doing extractions. They've really kind of turned that over to the oral surgeons. And so when patients aren't finding care in these big, broad regions across the top there, and they end up in pain, really, they just tend to show up in emergency rooms. And that costs a whole lot more than that dental treatment would have cost just in the first place. So, you know, I think the oral surgery numbers are very, very important when it comes to things like figuring out how people are getting care when they're actively in pain. So our work in this space of workforce is pretty multifaceted. These issues kind of need addressed everywhere. Like, we've got to address them all along the spectrum. So we focus on dental assisting support. That's crucial because dentists can double or even triple their patient visits when they have adequate help and support. Our dental assistant radiology program training does provide chairside assistance with a live instructor to help them pass their radiology exam in the state. We've had quite a few students enroll in that program in the last year. And then we really look at, you know, the pipeline work, the Speakers Bureau. We've got 80 career and vocational training sites for high school students in Pennsylvania, but only 22 of the 80 offer dental assisting. So that's a great, easy program to replicate for relatively low cost. And we could add hundreds of dental assistants to our workforce annually if we did that. So that's a pretty big goal of ours, is to see more of those programs. And then we also maintain that Speakers Bureau of dental providers. I know many of you are in that group. If you're interested in talking with middle school and high school students about dental careers, we can help you with that. We also do some hot topic webinars focusing on different workforce areas. Those we've been doing for almost 2 years now. And it's really a great opportunity to engage with experts and peers so that we can kind of figure out how to improve the workforce situation. And then the last really, I think, important area in the workforce space is medical dental integration. We need to have more integration of healthcare services that sort of works bi-directionally. For example, all medical offices could be asking dental screening questions. They can make good referrals to the dental office, and vice versa. So, hopefully you're starting to see this in your own lives. Does your PCP ask the last time you went to the dentist? Is your dental provider taking your blood pressure at every visit? Little small acts like that sort of help focus on education and prevention, which should lead to less disease in the long run. So when we're talking about not having enough providers, the more we can prevent disease, the better. So I think everybody can kind of play a role in this space. We can encourage our dental providers to focus on minimally invasive care. We've got a lot of new medicinal products and techniques that can be used instead of surgical ones to treat dental disease. We don't have to just repair teeth after the disease occurs. We can actually prevent the disease. And that approach, not only benefits patients, but it also boosts efficiency with practices. So more patients can be seen by less providers, which is really important right now. If you're not familiar with some of those techniques, we do have a free CE course available on our PCOH website portal, and you can learn more about it. We want to make sure, too, that everyone's out there talking about dental health careers. I feel like every party I go to, I'm like, oh, you have a college-age child? Have they considered dental school? That's just sort of what I do now. And so I think it's pretty important that we all do that. And that's going to really ignite the interest in the younger generations. And then, of course, the integrated care. So all hands on deck, let's try to collaborate among all the medical disciplines and really make sure that we're kind of moving that needle forward as well. So for those who also love numbers and data, I did want to share that we are expecting the publication of the Pennsylvania Department of Health's 2025 Licensure Survey Report any day now. So we will share that with you all as soon as it is available. So the last area we're just going to focus in, just talking a little bit about our outreach and connections, sort of the day-to-day work we do and who we're talking to. As a coalition, that's really important, right? Talking and collaboration is pretty important to the work we do. So on this slide, just focusing on our oral health outreach so far in 2026, just to highlight a few accomplishments, we've exhibited at or attended 24 different events already, reaching almost 3,000 people across 5 states, which is crazy. Additionally, we've presented at 27 different live and virtual events, actually 41 hours of presentations. So, if you think about that and imagine that for at least a few hours a month, we are talking to people directly and educating them on oral health. And I also wanted to mention that we have Nora here at PCOH now, who's able to help community organizations and our partners with resources to find dental access. So, we have a dental access coordination program. We want to help people find, the offices in their community that can help them. And for years, we didn't have a dedicated staff person to help with that. So Nora's doing a great job as she gets started with us in that space as well. And then in 2026, some more numbers, just because I think as we grow, that's really what makes us the most effective in our work. We did reach more than 1,200 stakeholders statewide now, which has really enhanced our outreach and collaboration. Our social media and website visits continue to grow. When I first started with PCOH in 2017, I believe the first time I checked out our Facebook page, we had about 35 followers, and we had last posted 2 months prior or something, which we knew we had to change. If we're going to engage with people, we need to use social media. So really proud. Amy's been working super hard on this, and we're now up to almost 2,000 Facebook followers with daily engagement, and we've got thousands going to our website every year as well. I do want to call out the work we do with our request materials page. We often hear that people are seeking resources, whether print or electronic, that can help them in their work. So we developed a page on our website a few years ago where people can request copies of our materials and even some of our partners' materials that we have permission to print and share. And just since January, we've already distributed almost 10,000 copies of our materials, which is pretty incredible. I know not everybody's keen on paper. but sometimes nothing beats just being handed something that you can look at and read. So, we're always looking to add more resources as, time and money and demand allows. So if there's something specific you're looking for, definitely let us know. We've worked collaboratively with other groups on developing materials as well. So just a few pictures I wanted to share of our springtime travel. And I did total it up just because I was curious. Just in our driving miles, we have driven over 7,000 miles in Pennsylvania this year, attending conferences, events, meetings, presentations. So I think we're getting out there. I think we're sharing a lot of great information, and we're really hoping that we get to keep doing that. So what's next, right? What are we looking at moving ahead? The next steps for our org, I think it's pretty exciting as we sort of grow and we get bigger and bigger. We are set to launch our annual request for proposals for both fluoride equipment grants and oral health plan mini grants later this summer. Those are initiatives that help us sort of direct resources to, where they're most needed in the state and sort of help progress the goals of our state oral health plan. We're also going to assist the Pennsylvania Department of Health Oral Health Program in writing and hopefully securing the next 4 years of the HRSA Oral Health Workforce funding. The state has received this competitive award the last 3 cycles, so we're fairly confident that we can get it again. We're doing great work in this space. We currently have 4 pending grant applications that are all each targeting critical areas. So, community outreach, maternal health, workforce, all grants that would be integral to expanding our impact and really kind of letting us go and address the problems that we know are there. And then another kind of important development that we're working on right now is the formation of a provider work group. So we've had a lot of interest from stakeholders in convening a group. We hope to launch something this summer where we could have dental providers that are actually helping to guide our initiatives and making sure that what we're doing is meeting the real world needs of our providers. We'll continue to do as much as we can for adult dental benefits and Medicaid. That sort of just goes without saying. Our continuing education course portal and our data dashboards that are on our website, we're hoping to revamp a lot of that information to give some more updated info and better resources, which will also enhance sort of learning and data-driven decision-making, right? So anybody who needs that information, whether it's for a grant application or a report, you can get that information from us. We share all of the data that we have. We're also improving our tracking of water systems. So we want to purchase a system that's going to be able to track agendas and minutes at the community level and sort of allow us to stay ahead of those fluoride cessation conversations. So that's on our agenda as well. And then the last couple pieces here, many of you, I'm sure, are familiar with the Federal Rural Health Transformation Program. We've been tracking that very closely. We're awaiting final decisions from the administration on the State Advisory Council. We feel pretty strongly that we should have a seat at the table, specifically because oral health workforce was mentioned in the application, and we want to make sure oral health is adequately represented. And then lastly, we have a pretty busy schedule ahead already with just through the remainder of the year. We've got 20 more exhibits and presentations already on the calendar, and probably we'll add another 20 by the end of the year because oftentimes we get asked to do presentations, pretty last minute or within a few weeks. So our bigger events, though, we know we already have 20 more of those. And so we'll stay pretty busy through the end of the year, kind of working through all of those things. Wanted to also mention, make sure you mark your calendars. We've got, our updates that we do, so the date for our next updates on there. We also plan our state oral health summits 2 years in advance. So next November, we've already got the hotel booked in Harrisburg, and we'll be ready to have our next oral health summit next year in 2027. And then we'll also still be doing our dental assistant radiology training courses. We're now able to take 12 students per session of those, and we offer those a few times a year. And then we'll continue our workforce webinar series as well. So lots of ways for you to hear from us, engage with us, But you don't have to wait until there's an event or a webinar. You can always talk to us anytime. We're always here to engage and talk with folks. So some links to our social media pages. So hopefully, we do send out our weekly newsletter, but we also put a lot on social media that doesn't always make the newsletter. Our newsletter is pretty brief and short and designed intentionally that way. We don't want you to get lost in it. So oftentimes we can put more out on social media even than we have in our newsletter. So I'd encourage you, if you're not following us on social media, to definitely do that. So with that will sort of open us up for some time for some questions. I do want to mention a couple things. I have a link on the slide here today, and we'll send it out after, and I know Natalie stuck it in the chat. We've got a quick survey about today's webinar because we want to make sure that the information we're giving you guys is what you want and what you need. And then we also have a link there for our 10-year anniversary donation campaign. So if anybody has the capacity or the desire and wishes to help support our work this year, we would very much appreciate that. So with that, I'm going to kind of turn over to our questions. So our question and answers, make sure if you'd like to ask any questions, you can just put them in the chat or into the Q&A right now. We do have a question, in the Q&A already, thinking about, how aggressive have we been to support, lobbying efforts, right, to talk about dental funding in the state and integration of oral health programs. I think that's an interesting one because we work with a number of organizations that have lobbyists and use lobbyists. We have never, not that we couldn't, right? So a 501c3 can do some lobbying in limited amounts, but that would require a lot of funds. And so for us personally as an organization, it's not something we can financially support at this time. But I think we've done a pretty good job of working with other organizations, lobbyists, to sort of help direct some of that interest into public health as well. So I think, if anyone out there is with a group that has a lobbyist, right? So, we've worked with a number of different professional dental organization lobbyists, and even just practice lobbyists. We are more than happy to meet. Actually met with someone yesterday to talk a little bit about, ways that we can sort of share our resources that will help their efforts and also help our efforts at the same time. Because I do think we have a major issue in our state right now that we don't put a lot of state dollars into dental. And for a variety of reasons, right? There's lots of places to put state dollars. But I think at this point, knowing that we're talking about number one chronic disease, right? We're talking about a completely preventable disease. We're talking about provider shortages that are bigger than any other healthcare provider out there right now. I think it is sort of our turn to get our piece of the pie. And so we're happy to have those conversations for sure. So any other questions? I know trying to drive that out of the box thinking is tough. We get ideas, I swear, the lightning bolts come through every day. Hey, we should do this. Hey, we should do that. But with a staff of 6, limited dollars, and 80% of our dollars coming from grants, so those projects are already directed, it does become a little tricky to do that out of the box thinking. It takes a few years. So, all right. And I know, let me just double check here. We've got, if there's any other questions here. I know we've got Rick Berkman. Do you want to ask your question live? We can ask you to do that if you'd like.
Can I ask it?
Yep, I can hear you.
Okay. I tried to type it in, but it got stuck. 3 things. One, are you going to forward the recording and the slides? This has been a great presentation, so we can share them with other people?
Yes, definitely. You'll have all of those, the slides and the recording.
2, I don't know your overall budget picture, but if you have an annual report, you can also share. It'll give me at least a feel for your annual financial situation.
Yes, absolutely. Yeah,
And,
and we can, that's a great idea. We can send those around afterwards, send
good.
our last impact report.
And three, do you have any contacts with the Community College of Philadelphia on either their dental hygienists or dental tech programs?
Yes, yes, we actually do a training with their students every year. So
Good.
we are engaged with them and working with CCP.
Good, good. Well, those were my three questions. Thank you. This has been very helpful. It's a big
Of
project,
course.
and unfortunately, our federal government's not helping us, nor our state government. But we'll have to work at it.
Yeah. Yeah, it's been a hard environment for sure. So, and then a little bit of another question came in talking about, you know, other states retaining new graduates. What do they do differently than PA does? We actually would love, we have the data, but we haven't really done a great analysis of that yet, to sort of figure out, of those that are graduating from other states, you know, what are their percentages like? How do we compare that? You know, because some of it is just funding, right? Some of it is just environments, taxes. We know that all of the bordering states, except for West Virginia around us, are paying their dentists more. If you look at the average general dentist salary in Delaware, it's actually twice what it is in Pennsylvania. So that's a problem. And so we've got to figure out how to fix that, I think would help a lot. And making sure that we're not putting regulations in place that make it so difficult to be a dentist in Pennsylvania. So those are sort of the areas that we want to focus on as soon as we have capacity for the research side of it. So any others? I know we're getting some different comments and things. Thank you guys so much for all of your comments. That's wonderful. Anything else? I'm just waiting to see if anything else comes in through the Q&A. I think we've got most of them here. All right. And just give it one more minute to make sure we don't have anybody typing questions. Okay. Now, of course, as always, today is not the end of the conversation. I know I'll probably get about 5 emails before the end of the day from folks with follow-up, and I love that. That's exactly why we do this. So please definitely reach out, and don't forget to do the survey that's in the chat there to make sure that we can make sure this was beneficial to everyone, see what we need to change or not change. That helps us a lot. And stay tuned for some really fun stuff coming out from the 10-year anniversary this summer, because I think it's been amazing. And we have some of our same stakeholders that were leaders 10 years ago that are still actively involved in the work we do. And I think that's wonderful. So thank you guys all very much. I'm not seeing any other questions. So I think we will call it done for today and continue the conversation in the future. So, thanks, guys.